Good day. We are the researchers from BSN3F Group 1A. I am Glissy Brillantes, and together with me are Ella Lagavante, Dayan Anyog, Joseph Bayona, and Sofia Bulfa. And we are here to report on our research study entitled Level of Knowledge and Occupational Safety Among Nursing Students During Clinical Exposure. Let me first discuss the purpose of our study. To start with, nurses working in hospitals from all around the world are exposed to different occupational hazards. In order to protect nurses from the risks present in the workplace, occupational health and safety focus on maintaining a safe working environment by reducing the risks of the aforementioned incidents. Also, with this information in mind, the researchers chose to conduct this quantitative study measuring the level of knowledge of the nursing students that has not yet been studied by other related literature in order to give light to the present knowledge of the soon-to-be registered nurses in the Philippines. And lastly, in order to fully prepare nurses to engage with such risks, their level of knowledge in occupational health and safety should be adequate to back them up in minimizing the level of risk in the clinical area.
In the objectives of the study, the purpose of this study is to determine the level of knowledge on occupational safety among nursing students during clinical exposure. What is the demographic profile of the participants in terms of sex, year level, and general point average or GPA? Second, what is the level of knowledge on occupational safety among nursing students during clinical exposures based on identification of risks and hazards, instructions for occupational safety, handling infectious agents, using of personal protective equipment, and reporting and documenting. Third, is there a significant relationship between the level of knowledge on occupational safety among nursing students during clinical exposures and profile variables such as sex, year level, and GPA?
Methodology, research design, quantitative research design. To be specific, the sample population 231 comprised of the third year and fourth year nursing students with the use of Sloven's formula. The researchers utilized stratified random sampling was performed on each stratum or in the study, there are sections of the nursing students. Research instrument, the study utilized a researcher-made questionnaire with integrated Likert scale. Part 1 consists of demographic profile of the nursing students. Part 2, questions to assess the level of knowledge of the students on occupational safety. The questionnaire consisted of 25 different questions, grouped to certain sections, namely identification of risks and hazards, instructions for occupational safety, handling infectious agents, using of personal protective equipment, and reporting and documenting. Moving on to the results and discussion, Figure 1, demographic profile of participants. So this showed the first part of the questionnaire which contained the participants' demographic profile. In terms of gender, females constitute the majority of the participant with 177 students, which is 76.6% out of the total sample population of 231 nursing students. As for the male participants, there are only 54 students, which is 23.4% out of the sample population that was derived from the random sampling conducted by the researchers. As for the year level, participants coming from level 4 had the greatest number of participants, accounting for 116 of the sample population, which is 50.2%, with a small difference compared to level 3 with 115 participants, 49.8%. In this regard, the researchers made sure to balance out the number of participants when it comes to their year level to get an even view of the level of knowledge of both year levels. As for the grade point average, this showed that 138 of the participants had an average of 1.6 to 2.0 with a percentage of 59.7%. The nursing students from the third and fourth year with this GPA comprised the majority of the sample population of this study. Meanwhile, the second highest population in terms of GPA are students with 2.1 to 2.5, comprising 68 nursing students and 29.4% of the total population. This is followed by students with the highest GPA of 1.0 to 1.5, comprising 17 students or 7.4% of the population. Then the lowest of students belong to those with a GPA that ranges from 2.6 to 3.0 with 8 students, which is 3.5% of the sample population. Lastly, there is no data collected on students with a GPA of 3.1 to 3.5.
Next, Figure 2 shows the relationship between the level of knowledge in occupational safety and profile variables, and according to the table, there was no significant relationship between the level of knowledge in occupational safety among nursing students during clinical exposure and the profile variables, namely sex, with a p-value of 0.09, year level with a p-value of 0.2, and general point average with a p-value of 0.1. Therefore, the null hypothesis was not rejected at a 5% level of significance.
For the conclusion, the study sample consisted of 231 nursing students, with 177 or 76.6% being female and 54 or 23.4% being male. The study found that the majority of the participants came from level 4 or 50.2% and level 3 or 49.8% peer level, as they have more exposure in clinical duty. In terms of GPA, the majority of participants, 59.7%, had an average of 1.622, and most of these students were from third and fourth year levels, and there was no data collected on students with a GPA of 3.1 to 3.5. Additionally, findings revealed that the nursing students had a very high knowledge in all categories in practicing occupational safety during clinical exposures. Overall, in identifying risks and hazards, nursing students from both sexes are very knowledgeable in dealing with this. Therefore, this study concludes that there is no significant relationship between the level of knowledge on occupational safety among nursing students during clinical exposures and profile variables such as sex, year level, and GPA. Therefore, null hypothesis was rejected at a 5% level of significance. This means that the level of knowledge on occupational safety among nursing students during clinical exposures is not influenced by their sex, their year level, or their GPA.
And lastly, for the recommendations, first is the university administrators. This study may enable the administrators in analyzing and determining the current state of nursing students' safety. Next is occupational safety officers. This study may be important for occupational safety officers since it will help them develop effective techniques and valuable methods to make policies and regulations in the workplace more thorough and sustainable. Next is the clinical instructors. The study may be important for nursing clinical instructors since it helps them to develop effective techniques and valuable methods to make learning more thorough and sustainable, and for students to be more ready in an actual clinical setting. Next is the nursing students. This study enables the student to be well informed and prepared for their future career and to be well aware of how important it is to observe hazards and for them to be ready for clinical exposure. Lastly, the future researchers. This study allows future researchers to broaden the scope of their own research and to enhance their research study. That's all, and thank you very much.